Hello and welcome to this joint event hosted by 0 to 3 and the Prenatal-to-3 Policy Impact Center, where we'll be discussing equity and evidence, data tools to inform paid family leave policymaking. I'm Cynthia Osborne, and I have the privilege of being the director of the Prenatal-to-3 Policy Impact Center from the University of Texas at Austin. And I'm joined today by my co-host, Myra Jones-Taylor, who's the Chief Policy Officer for 0 to 3. And we're really excited to be able to join you today in a conversation about this important topic of paid family leave. Both of our organizations are committed to ensuring that children get off to a healthy start right from the beginning. And we each work with states to try to make that a reality and believe that policies at the state level really do set the stage and create the environment in which children can thrive. And today, we want to share with you some of the evidence that we have that we hope is a resource for you as state leaders, state advocates, state policymakers, that you can use to help inform the policy decisions within your state. We know that there's a wealth of resources out there in this space, and we're so grateful for that. And we're going to share with you today two of the tools that each of our organizations has created, both the State Policy Roadmap and the State of Babies Yearbook, that we hope can help to facilitate all of the policy efforts in your state. We also are joined today by folks from who have actually had this lived experience of pushing policy through in states, both in the state of Rhode Island and the state of Oregon. And having that experience about actually how it's done, the challenges, the implementation, that of course is also so important as you think about creating and implementing policies. We're also joined by Alison May from the National Conference of State Legislatures, who will really help us to see what this policy landscape looks like in paid family leave across the nation. We know that you need information when you're developing and implementing policy. It comes in all sorts of ways, both from research, from data, and from the lived experiences of those who have been on the ground trying to implement it, and from the stories of those who are actually the target of our policies, the families and their experiences. And we want to demonstrate to you how these tools can help to provide information across this range of areas. So again, thank you for joining us today. And our discussion is going to be focused primarily on paid family leave, but we will share with you a little bit about the tools in general and why the policy is important, and have a conversation with our folks from the state so that you can really understand more about what they're experiencing in order to make this a success. So I'm going to begin by sharing with you information about the Prenatal-to-3 State Policy Roadmap. I'm going to share my screen here. So at the Prenatal-to-3 Policy Impact Center at UT Austin, our whole goal is to help states as they develop and implement the most effective policies that will ensure that children get off to a healthy start, and that also create this equitable system of care. The science of developing child is clear about the conditions that children need in order to thrive. And what our goal was to identify the most effective policies that actually bring that science to life. And so one of the tools that we have to share with the field is our State Policy Roadmap. And I invite you all to see it on our website at pn3policy.org. And with our roadmap, what we did was begin with the science. Like I said, the science is clear about the conditions that children need to thrive. And this led to 8 policy goals that would create these conditions, that if we can do these things, then we will make sure that all kids get off to a healthy start, and that we can close the gaps in all of the disparities that have existed for for far too long. We need to make sure that children have access to the services that they're eligible for, that their parents can both work and care for children simultaneously, that there's enough resources in the household, that children are born healthy to healthy parents, and that both the parents and the child's health and emotional well-being is prioritized, and that we want to foster nurturing relationships between caregivers and children, whether it's parents or it's the child care providers or other trusted adults in the children's lives. And that when children do have delays or issues early on, or the family has other sorts of problems, that we can identify those problems early and connect families with the services that they need. So those are the goals. And what we did was comb through all of the existing evidence of our strongest causal studies to identify what is it, what are the policies or the strategies that states can implement to actually create those conditions. And we identified 5 policies and 6 strategies that actually currently have the strongest evidence base. I just wanted to make sure to point out the difference between a policy and a strategy. They are both effective at moving outcomes and improving the well-being of infants and toddlers and their parents. Policies, though, have been studied about how to implement them at the state level, whereas strategies, we don't have clear guidance yet from the research on exactly what states should do. And so we're really working to learn from states to see what's working best and what the most optimal types of implementation should be. But one of the most 5 effective policies is paid family leave. The research is clear right now that if we implement paid family leave, that of a minimum of at least 6 weeks, that this leads to a host of outcomes, improved outcomes for parents and ultimately children. And I'll talk a little bit about some of the limitations of the research to date, in that we know a lot of states are doing much more than 6 weeks of paid family leave, and that when states are proposing legislation, that they're thinking about a longer time period. And we fully support that. It's just that the current research base was done on states that had implemented 6 weeks at the time when the research was conducted. We took these goals and the different policies and strategies and created this framework for folks so that you could see, based on what your goal is, what are the most effective policies and strategies that impact that goal. And you can see with paid family leave, this is a policy that impacts 6 out of the 8 goals that we have. So from access to needed services, parents' ability to work, sufficient household resources, parents' emotional well-being, and nurturing responsive relationships with children and optimal childhood development. It actually is the policy that does more for children and families than any of our other policies. When we are also not only just identifying what the most effective policies are, we're tracking states' progress toward implementing those policies. And we understand that policy is a long game. As you can see, there are states that have implemented all 5 of the most effective policies and 3 out of the 6 strategies. And then we have other states that are still needing to get off the mark, that they haven't yet implemented any of these. But we're going to be following the progress of states on all of these policies and strategies. And like I said, because policy is a long game, we don't think of it just as whether you have passed a law. We want to make sure, first of all, that families are actually able to receive those benefits before you really move to a yes on our roadmap, which creates a little bit of a difference between what we have and what some of the other folks who will even be talking today will present. But we demonstrate that sometimes states are just in the process of discussing or proposing bills. Others have implemented something, but maybe not all the way to what the research says is the most effective to impact outcomes. So we're tracking state progress over time. We're also tracking states' progress on 20 different outcome measures so that we can kind of push our way to saying that by enacting and implementing these policies, is actually leading to improvements in children's outcomes. This happens to be Texas outcomes, but we have a state policy roadmap for each of the states plus DC, and this is available for each state on all 20 of these outcomes. In the roadmap, we also have a policy profile for each of the effective solutions. And in this policy profile, we describe both what it is and why it is important for this age period. But we also go through the research to say, how does this policy actually impact outcomes? So we provide both the research evidence as well as a lot of data to show variation across states. If we're using paid family leave as an example, this is a policy profile for paid family leave. And currently, there are 6 states in which families can actually receive the benefit. There are 10 states in which they have adopted this policy, but there are 4 that are still waiting for the implementation. For each of the policies that we have, including paid family leave, we also have these examples of impact. We pull from the rigorous studies and give this sort of evidence or information that we're hopeful is helpful for states when they're trying to make the case that this is a policy that would be beneficial for children and families in their state. So, for instance, the research shows that access to paid family leave is associated with a $3,400 increase in household income. We also know that it is associated with returning to your pre-birth employment, and that it has these strong effects both on leave taking, on your ability to work, on the resources you have in your household. And it also has an impact on mother's mental health. It has an impact on her physical health. And it really does spur that interaction between mother and child, where there's higher levels of reading, more time to have routines with your child, and so forth. And so, again, we're demonstrating that there are states that haven't got off the mark at all, haven't even discussed it. And then there's a lot of states in which they've made some progress. Perhaps their state employees are eligible, or there are, as Rhode Island's case, which Leanne will speak about, where they have 4 weeks of paid family leave, but not 6, which is the minimum in the research of what we know to be effective. This is a map of that table that you just saw. We also have information on several different elements of the policy so that you can see, as your state is trying to develop, what other states might look like. The number of weeks that they have off, the maximum paid leave, we have the average amount of work for the reimbursement rate that you can get, and then also information about when these policies are going to be going into place. Within our discussion, we also have information about how states fund paid family leave. And as Andrea and Leanne will talk about later, that funding strategy varies quite a bit as to whether states are building on an existing infrastructure, like a temporary disability insurance, or they're creating it from scratch, like they're doing in Oregon. I also just invite you to read about the policies more for those of you who like to read in depth. We have a policy clearinghouse, and it has comprehensive reviews on all of these policies, and we're adding more all the time. But the one on paid family leave will take you through kind of everything that you wanted to know and more about this policy, what it is, and what all the research says. We also pay particular attention to what the research says with regard to equity and promoting equity. And so that's a hugely important part of what we demonstrate. I also just want to leave you with the fact that each state has its own state policy roadmap, and you can get it from our website. We also have data interactives, and this information will help you to understand the types of bills that were passed, what they look like, what the legislation entails, and lots of information about that's about your state and other states, paid family leave policy, plus all the other policies and strategies that are effective. I encourage you to contact us, and we are here to answer any additional questions that you have, and we'll put this information in the chat for you. But I'm going to stop sharing now and turn it over to my friend and colleague, Myra Jones-Taylor, who 0 to 3 obviously has set this foundation for the whole field about the benefits of how to improve children's lives in lots of different ways. But the resources that they have on paid family leave are also robust, and the State of Babies Yearbook is a resource for the field like no other. So I'm now going to turn it over to Myra. Welcome, Myra.
Thank you, Cynthia. It's really great to be able to do this in partnership. We've been talking about having this convening together for quite some time, making sure that, our field, the field that we share is really clear on the evidence behind this, and then how we make the child development case. So excited to be here with you all. I'm going to share my screen and get started. All right, hope y'all can see that. So we know, let me get advance here. All right, so what happens in the first 3 years of life is unlike any other period, right? We talk about this so much in our field, but it's worth repeating for those newcomers and people who want to be able to make sure they have all this language down. We know that 1 million new neural connections are formed every second in the earliest years of life, laying the foundation for all future learning in school and in life. And time at home with newborns, infants, and toddlers gives parents the time they need to develop attunement between parents and babies, and to forge the basis of that lifelong relationship that they will share, hopefully. And it also gives parents the time to prioritize baby's health, with time to breastfeed and attend well child medical visits, which we know are so critical, especially now in the midst of this pandemic, and ensure that their children receive all necessary immunizations, again, something so critical right now, and may have long-term benefits for children's health. Young children also develop in the context of their environments. This is something we say all the time, where stability and supportive relationships nurture growth. And all families benefit from parenting supports, and many, particularly those facing economic instability, require access to additional resources that help them meet their children's needs and their families' needs. And because stability is inextricably tied to healthy development, ensuring that the early childhood experience is well-resourced must be viewed as an important part of the education system in all of our systems, even if it feels kind of unconventional to think that way. So paid family and medical leave benefits babies in numerous ways, and we heard this from Cynthia already, but it's worth repeating. And we found this clearly in our annual State of Babies Yearbook, which bridges the gap between science and policy by synthesizing national and local data, state data on the well-being of babies, America's babies. And routinely, we find differences in the early experiences of babies and families that lack economic security, that we know we can make a difference in later well-being. And last year, we focused especially on racial disparities across the country and confirmed what many have long known, that Black and Brown babies start at a major disadvantage due to inequities baked into our fiscal policies and all of our systems. Now, just 17% of all working people in the United States have access to paid leave through their employers, and lower income workers are even less likely to have access. Only 27.5% of babies live in states that have paid family medical leave, and we saw that on that really great slide that Cynthia just shared. Okay. Without a paid leave policy, families are forced to make difficult choices for their children's care because they cannot do without a paycheck and are unable to take time off to meet family needs. And these impossible choices ultimately harm young children's development, relationships that they should be forming, and the establishment of routines. And having time to care for their babies helps parents catch developmental problems early. This is especially important for caregivers of infants who are considered at high risk, such as babies who were born preterm or at low birth rates, and those who will have illnesses of identified disabilities. Time with parents can be a matter of survival. After reviewing family leave policies in 19 countries, researchers found that a 10-week extension of leave was predicted to decrease overall infant mortality by 2% and post-neonatal, 28 days to 1 year, that period there, of infant mortality by 6%. Think of all those babies who were behind those percentages. Centering equitable work practices and public policy, like paid family leave, will allow for families to better meet basic needs, as well as cultivate and strengthen the relationships with their children, the foundation of healthy development. And then I'm going to share a little bit about the family perspective that we have. We have the blessing of being able to connect with families from all 50 states through our Strolling Thunder work. And we know from our families that paid leave policies can make all the difference. For Julianne, an essential worker at a WIC clinic, paid time off meant that she was able to spend meaningful time with her newborns when they were born preterm. She had a high-risk pregnancy, and her twins were born 5 weeks early. She had used most of her time off for bed rest and hospital stays before she gave birth, right? So she'd exhausted that benefit. Without paid leave, she would have needed to go back to work much earlier, as her family would not have been able to afford for her to go unpaid. As her husband ended up losing his job due to absences and late arrivals because of the complications that she experienced during preterm. So a really challenging time for her. For parents like Julianne, paid leave makes all the difference. Past months have made it clear that the workers we deem essential are those least likely to be economically secure. They are most likely to be burdened by unpredictable work schedules and do not have paid leave. So this is something, it's really a question of equity, especially as we think about where we are now in this pandemic. So I'm going to share some data on state policies from State of Babies. We're really excited about what's happening in states. We heard a little bit of that from Cynthia. But paid family and medical leave is one of more than 60 indicators where we use to help policymakers, advocates, and stakeholders see the babies and families behind the numbers, right? Paid leave policies live in our strong families domain. So we have 3 domains: good health, strong families, and positive early learning experiences. Meaning, and having them there in strong families means that they promote family resilience and well-being, helping families meet basic needs and mitigate adverse childhood experiences. And paid leave is also crucial to supporting our 2 other domains, good health and positive early learning experiences. As of last year's yearbook, only 9 states had a paid leave program, and only 11 states required employers to provide sick days that cover care for a child. And this data is from the National Partnership for Women and Families report on state paid and family leave insurance laws through August of 2019. As we prepare for this year's yearbook, the number of states with a paid family leave program is still only 9, but Colorado will soon join these states. Actually, I think Colorado just did, sorry, having passed a ballot in November. And just 1 additional state offers paid sick time to care for a child. The US is nearly alone among the world's nations in its lack of a federal paid family leave policy. And family leave is used primarily to care for a newborn child, but also, or should not also be considered that way. We also know that we need it to meet other exceptional caregiving needs, such as for older parents or caregivers in our lives, disabled people, those who are disabled or chronically ill, or a newly adopted child. We need to make sure this is comprehensive and inclusive of all family members. And the definition of family should be as broad and as inclusive there as well. So our advocacy efforts are strong. We have so many partners on the call, I'm sure, who are part of our Think Babies efforts at both the federal and state level, including our thoughts on best practices to support families and promote equity. In discussions, we discussed the tensions and the balance between federal and state advocacy on this issue, knowing that it's great to have states who are pushing for this, but we should not have one family be covered in one state and then move to another state and lose that coverage. We need a federal, a national comprehensive paid leave program. The data behind the State of Babies Yearbook makes it clear that our nation has been complacent for far too long, while families are struggling, especially in the midst of the pandemic when paid leave is such a critical resource. We have an emergency leave now, but we need to make sure that that is extended and made permanent. We as a country need to make sure that we do everything to do this for the babies we care about and for the families that we care about. And 4 years ago at 0 to 3, we realized we had an opportunity to change the conversation around babies and toddlers. And we saw a growing gap between current policy and the struggles of families across this country. And so we created Think Babies to make sure that we closed that gap. And we're so proud to partner with so many of you. We launched Think Babies to make our babies our priority. And like I said, so many of you guys are partners there. And through building advocacy capacity in states, and developing partnerships and alliances, and increasing the visibility of these challenges that many babies and families face, our model builds the political will necessary to advance equitable outcomes for infants and toddlers. And throughout the Think Babies campaign, we are launching a new advocacy toolkit that will be focused on paid family and medical leave. We're really excited, and there'll be more of that momentarily at the end of this session, where you can see that in the resource page. And this will give families and other advocates talking points, graphics, and sample op-ed to use in advocacy efforts. I'm going to talk a little bit more about paid family leave in the midst of the pandemic. And what we've learned from COVID-19 is clear. Early on in the pandemic, Congress passed temporary paid leave measures, recognizing the important implications that paid leave had on public health. Before that, the closest Congress had ever come to truly supporting our nation's workforce was the Family Medical Leave Act, almost 30 years ago. I was in high school. And protecting time off for work, off work for people who were welcoming a new baby or caring for a sick loved one, but it was unpaid, right? And that was truly historic legislation at the time, but it fell woefully short of what we really need. And we're still woefully behind when it comes to supporting our nation's families and children. And paid leave is a proven engine of economic stability and growth that gives today's workers and our future workforce, their babies, the best chance for success. And we saw that again in Cynthia's slides. The evidence is quite clear that this is good policy. And so we owe it to our nation's families and their infants and toddlers to put America's families first, and to really make sure that we make paid family leave a permanent policy solution in this country. I'm going to stop it there and stop sharing. And I'm going to hand it back over to Cynthia, who is going to moderate kind of a Q&A session. So I hand it over.
I think that we are having some questions come in, Myra, for both you and I. And there was one question that talked about the fact that because so much job churning has taken place because of the pandemic, so many people losing their jobs, starting new jobs, that many folks may not be eligible for paid family leave if it requires them to have been someplace in a short period of, for some period of time. And I didn't know if you wanted to talk about that at all, but what you see at the federal level that's trying to help to offset some of these and extend leave during the coronavirus pandemic. But that is an issue that, so long as we attach it to your employer, that's going to continue to be an issue that families and states are going to face.
Yeah, that's right. So we are seeing a lot of advocacy, I'm sure you all are too, to make sure that we make these the emergency paid leave that was passed in Congress, make that permanent. And so I think it's really important that we use the evidence that we've shared today to help make that case. We are hearing that it was very clear, the evidence was very clear from a public health perspective, what paid leave has done in the midst of COVID. It has drastically prevented deaths and illnesses and the spread of COVID, and it has allowed families to stabilize, if you will. But we need to make sure that we go beyond thinking about this in terms of COVID, right? Like, this is absolutely good policy. It's good public policy, but good public health policy. But we also know that even in times when families aren't in the midst of a pandemic, we know that it's really important, for all the things we've said earlier, that we need to have this. So this is something that's being pushed by many coalition partners. and we are hopeful. The Biden administration had also expressed interest in this, and this is part of their platform. We will see what happens with that. And we know this is a bipartisan issue. We know that we had great support on both sides of the aisle. And so we will continue to advance that. But make sure you're paying attention to the advocacy around making permanent these changes.
Yeah. There's another question about paternal paid leave and the benefits to families and children. And I don't know if you wanted to respond to that. I know a little bit about that. And the first part about that is that unfortunately, not as many men take paid leave when it's offered as women do. In our European neighbors have learned that they actually have to make it compulsory for men to use it or lose it. That has increased the number of men who take it, but it still is not ubiquitous in the way that it is for women. And what it really takes is for the men who are in managerial and supervisory positions to demonstrate that this is a thing that they do within their firm, that sends a signal and allows more men to do this. But it also has the reason that they can't is if they are the primary wage earner. In some states, the wage reimbursement just isn't sufficient to offset some of that. But bonding early with your child is amazing for both moms and dads. That is an important thing from the child's perspective. And also men are going through hormonal changes as well after the birth of their child and are likely to experience things like postpartum depression. And so these sorts of leave policies can benefit both the men and the women. And in dual partner households, regardless if it's two women, two men, or a man and a woman, this is an opportunity for that family bonding, and that it's really a benefit for both of the parents and the children. Did you want to add anything to that?
You nailed it. Nothing else to add. That's great. Thank you.
So there's another question that asks about whether we speak specifically about the different sorts of policy components that will ensure equity when we're talking about access to paid family leave. And you may want to address some of that specifically, but I know that Andrea Paluso, who is our guest today from Oregon, will also be talking about that and what they've really done to push that in Oregon. But did you want to talk about anything in the State of Babies about, you guys have the data broken down by race, ethnicity? There's a lot that you're saying there.
Yeah, I mean, I think this is why it's so important to make sure that this is a national comprehensive plan and that is not necessarily tied to your employer, because we know that there is a lack of access, that the jobs in which we find many Black and Brown families of color, essential workers, they often do not offer paid family leave. And so we cannot, add on added stress and then have inequitable policies if it is tied to an employer. And so making sure that we allow for a national plan would actually eliminate many of those the racial disparities that we see when these policies are tied to employment. And so many of these positions are just do not offer paid leave. And so that's really important. But I'm very excited to hear from Andrea. So I'm going to hold off and let her.
Yeah, no, definitely. We'll tease folks up because they've given so much thought to how to advance equity with this policy. And I think it's so important. The last question, because I know that we need to wrap up, was about kind of what is the overall ask? In our policy roadmap, we say that evidence to date says that it's at least 6 weeks. In the State of Babies and your work, you advocate strongly for 12 plus weeks. And I just want to make sure that folks understand that 6 weeks that we're talking about is a floor, that's what the evidence says to date, and that improves those benefits, but more is likely better. And we're not an advocacy organization, so we don't necessarily take a position on what folks should do. We can tell you what the evidence says, but you may want to speak to what it is that you would like to see and make sure that folks get that.
Yeah, so we talk about, there's a paid leave checklist. And so when we advocate for paid leave, we believe it should be at least 12 weeks. And I appreciate you clarifying that. I think that's really important. It's something we've talked about between our two organizations. So making sure that it's at least 12 weeks, that the wage replacement is adequate. That it is inclusive of family definitions, and that it goes beyond parental leave, that we make sure that this is leave that would allow for elder care in the event of your own illness. We know that paid family FMLA, the overwhelming majority of people who use it actually use it to take care of themselves or older loved ones. And so making sure that we don't undermine how many families are or limit access, given the way we know that families are already using FMLA, and that it is national, right? I'm very happy. We want you all to continue to advocate in your respective states, but also to make sure that as you do that, you will put pressure back at the federal level, because we cannot have a state by state policy. The COVID has made that very clear that we need to have a national response when it comes to paid leave.
Yeah, and I think that some of the states that are doing this well will say that they want to make sure that any national policy, it meets the top standards, or that states can at least build on. But now it's time to turn over to the states, and I'm going to check out here. And Myra, I know that you're going to introduce our next guest, but thank you for this conversation. I really appreciate it.
Thank you, Cynthia, and thank you everybody for those questions. And I know there were many in the Q&A section that were not answered, so we will definitely respond to those later. Not in this session, but hopefully another time. So I'm pleased to introduce today's speakers, who will share their experiences with paid family medical leave in two states, in Rhode Island, so on the East Coast, and in Oregon. And we know that there is no one size fits all approach to developing a paid leave policy. And today, these speakers will share why they took the approach that they did, how they tapped data to inform their choices, and how these choices prioritized equity in leave taking, which is so important, and clearly on the minds of many of you. Today's speakers are Leanne Barrett, who is the Senior Policy Analyst at Rhode Island Kids Count, Andrea Paluso, who's a Regional Organizer at Family Forward Oregon. We're very excited to hear from them. I'm going to hand it over to Leanne first. Hey, Leanne.
Hello, everybody. I think I've turned myself on, and I am going to share my screen. If you hold on 1 second. Okay, I think I'm all set here. Thank you so much, Myra and Cynthia. And these national resources and report cards are so helpful to state advocates as we work to move things forward within our state, and to hear about our neighboring states and states in other part of the country who do things better, or who we can compete with to be the best, I find to be actually very helpful. So I'm here to talk about Rhode Island's paid family leave program, which I consider really to be one of the best things I've done in my career, is be involved in this. I was not the leader at all, but we played a really important role in bringing the child and parents perspective to the coalition. So in Rhode Island, our paid family leave program in 2013, we joined two pioneering states. The two states who had it before us were California and New Jersey. And we became the third state to establish a state managed paid family leave program for workers. Our paid family leave program is called Temporary Caregivers Insurance, or TCI for short. And like in California, New Jersey, our paid family leave program is built on our state's temporary disability insurance program, TDI. So you can see why we call it TCI and TDI, which was established back in the 1940s. There were 5 states who established state managed disability programs. The other 3, I think, are Hawaii. Oh, no, Rhode Island is 3. So the other 2 are Hawaii and New York. And they've been really essential frameworks that allowed our states to move forward a lot more quickly with paid family leave. So in Rhode Island, both of these programs are connected together, managed under the same agency, and are funded entirely through employee payroll reductions. In other states, there is an employer contribution too, but in Rhode Island, going back to the 1940s, it's only been employees. The TCI program in Rhode Island that passed in 2013 and began providing leave starting in January 2014, provides 4 weeks of partial wage replacement for a new child through birth, adoption, or foster care, or to care for a seriously ill family member. The TDI program, which is also really important for families and pregnant women and who are or right after childbirth, that has been around since the 1940s, providing a lot of support to families in Rhode Island. So we also have worked on protecting the whole system, both TDI and TCI. I myself had a baby in Rhode Island in 2004. He's now 16 and he's in the other room, but I was on bed rest starting at 32 weeks, and I got partial wage replacement from 32 weeks through 39 weeks when I gave birth. And then I had 6 weeks of at home with partial wage replacement to recover. So this is common in lots of private disability systems that exist in other states. And that's a really essential part of being able to stay home when your doctor tells you to go on bed rest. It can also be used for severe maternal depression and is pretty commonly used for recovery from childbirth. Back in the 1970s, there was court cases, I guess, which clarified that women who give birth, that's an injury, and that you're entitled to disability leave, just like other kinds of injuries, like breaking your leg. Okay, so I think I mentioned already, I was not the lead on this at all, and but part of a really strong coalition. The more I do work on putting out informative reports and citing other national reports, the more I realize it's not that people don't understand, it's that we need to move to organizing and advocacy and applying pressure to decision makers to actually make these difficult changes in state policy. And so this coalition came together, and the Women's Fund of Rhode Island was really the lead at the beginning. Currently, the lead is now the Economic Progress Institute. Rhode Island Kids Count has been a strong partner from the beginning and currently. And our advocacy brought in the American Academy of the Pediatrics Rhode Island chapter, which has been really essential, another important advocate for kids and parents. And again, the AARP, the Senior Agenda, have been very strong advocates, as have the labor unions, Working Families Party, and others. The other thing to say is this coalition needs to stay in place and be connected, because as soon as you pass something, there are, which can be challenging, there are attempts to weaken it or take it away. So we've had multiple challenges to this law, including attempts to allow people to opt out of the paid family leave program, which we have successfully fought off by testifying at hearings and also providing data at the city town level for every state legislator about how many of their families are using both the TDI program for pregnancy complications and the TCI program for family leave. Okay, and then earned sick leave I threw in here because I think Myra and Cynthia both mentioned that paid family leave is not enough, and we did work after we did paid family leave on earned sick leave, and in 2017 we passed a earned sick and safe leave law that requires employers to provide at least 5 days of earned sick time per year. Workers can take this leave for both preventive health care and leave during routine illnesses for themselves and for family members, including children. This leave can also be taken for domestic violence issues such as moves or court appearances, etc. So it can be taken in blocks of 2 hours for a doctor's appointment, which is really important because the regular paid family leave comes in blocks of 1 week at a time and it's for serious illnesses and not just regular doctor's visits. So there we do know that all families with young children have 13 well child visits in the first 3 years of life, and that young children, babies and young children, often experience 7 to 8 routine illnesses per year, where they really need to stay home from childcare. Pregnant women also have a lot of doctor's appointments that they need to leave work to go to. There's usually about 8 to 12 routine prenatal care visits and more for higher risk pregnancies. Okay, this is data about how our program has grown from the beginning. 2014 was the first year. 2019 is the year I have the data from most recently. I don't have 2020 data yet, but it has grown substantially, but pretty consistently. We've seen about 80% of claims are to bond for with a new child, and 20% are for seriously ill family member. Of the 5,766 approved claims to bond with a child, 98% were for a newborn child and 2% were for a newly adopted, foster, or other child. And we can see that about 40% of approved claims were filed by men and 59% were filed by women. This is for a new child. It's actually for new children. Men are more likely to do it than for serious family illness, which is there's more women who do serious family illness. Oops, hold on, there we go. Okay, so this is one of the issues that we're working on right now around equity in particular, is that we have a wage replacement rate at 60% is the lowest among the states that have launched or enacted a paid family leave program, and that we know that low wage replacement rates limit use of paid family leave. You can see on this chart that we compared the percentage of people who contribute to our TCI program, so they pay a tax. 44% of those who contribute make less than $20,000 a year, whereas only 16% of that people in that wage category actually use it. So it is favoring higher income families. And actually the whole way this is financed favors higher income families. We're also trying to fix that because you pay a tax up until $74,000 a year. It's 1.3% of your income up to $74,000 that you earn, and any money you earn above $74,000 doesn't get taxed. So it's really an inequitable financing system that goes back to the 1940s and is a challenge to change, but we've been working for 3 years now to try to have the state make that a more equitable system, increase the wage replacement rate, and remove the cap on the withholding tax. Okay, this is the length. So we are only in TCI offering 4 weeks right now. So that really impacts people who don't give birth. So dads, the second parent, people who adopt or foster kids, they only get 4 weeks. In Rhode Island, because we have a TDI program, if you give birth, you do get 6 to 8 weeks usually. So that is a huge help. And we often get asked questions about all of the different laws and how much is enough kind of questions. So we've been consistently saying you need 12 weeks. The American Academy of Pediatrics says no child under 12 weeks, healthy children, should not be in childcare. And if you have a child with health problems, they should be even older when they go into group childcare. So we've been using that, and there are reports out there that really say for best outcomes for children and for parents, it's about a 6 months. So we present that so that we're not saying we want the full amount. We're trying to say 12 weeks is the minimum, and there is a lot of evidence that more time is better for both the child and for the parents. Okay, these are charts that we use that are very helpful comparing ourselves to our neighbors. So these report cards that provide data, Colorado is not on here, but you can see Rhode Island is only at 4. And now we have our 2 neighbors, Massachusetts and Connecticut, that are at 12 weeks. So to be competitive, we need to meet the 12 weeks. And we also are only at 60%, where you see the other states, and including states that followed us. New Jersey had a lower wage replacement rate. They've gone back and fixed their wage replacement rate, so it's way better. And we are working to fix our wage replacement rate too. And this is just an example. We have about 8 priorities in our Right from the Start campaign, which is our Think Babies. We're a Think Babies state, and I'm the coordinator of our Think Babies campaign. And this is how we phrased it this year, that we are working to improve our state's paid family leave program, which is called TCI in our state, by increasing the wage replacement rates and extending the number of weeks to match national benchmarks. these are the rest of our priorities in case you're interested in them. And I just wanted to close my thing by saying how helpful all the national folks are, including NCSL, I know who's on here, but National Partnership for Women and Families has been tremendously helpful to us, as has 0 to 3. And the Family Values at Work group, our senator, Gail Golden, who was the lead sponsor when it passed in 2014, her day job is at Family Values at Work, and she's one of the national experts on how to actually advocate and get paid family leave passed in your state. So I'll turn it back over to Myra.
Thank you, Leanne. It's always so good to hear what you all are doing. And I just love the use of those slides to show how other states are doing that. I know being formerly in state government, how that competition is very compelling to legislators. So good for you and keep up the fight. I'm now going to hand it over to Andrea Paluso, who's going to share her experience from Oregon.
Hey everybody, thank you so much for inviting me to join you today. I'm just going to walk you through kind of how we got to some of the policy bottom lines that we did in Oregon and a little bit about why. So again, my name is Andrea Paluso. I'm the Executive Director of Family Forward Oregon and Family Forward Action, that are our sister organizations doing work to organize mothers and caregivers. In Oregon, we have a whole transformational organizing program on the ground that is bringing mothers and caregivers into the process of making systems changes to support care and caregiving. We come from the kind of mission and theory of change that caregiving, as I think we're all really seeing demonstrated during COVID, is really essential work. Both the kind of caregiving that's happening in an unpaid way in families, and also the paid caregiving happening in childcare and home care and other care settings, which disproportionately relies on the very low paid labor of women of color. But caregiving has, for a long time, forever in this country, really been treated as invisible. And it is relied upon to kind of build strong families and strong economies, but it's not recognized as that. We've been working on paid family and medical leave since we started as an organization. We were founded by mothers who were impacted by this issue about 12 years ago. And there were active conversations at that time in our state about paid family and medical leave, but about a program that was really inadequate. And so, it didn't pass even at that inadequate level. I think in large part because, many of our lawmakers aren't people who are directly impacted by this issue, and it just wasn't seen as a priority. Nor do I think they really understood the kind of broad family and economy-wide impacts it would have. So we have been focusing over that time on really building this transformational organizing program that moves folks from kind of a personal understanding of an issue to a more political and actionable kind of way of working together. And we also are a partner in State of Family Values at Work, which I realize a couple of folks have mentioned, which is a national network that has been investing in organizations like ours for 15 to 18 years, not our specific organization, but others in other states, and really building a movement around this issue of paid family and medical leave, helping to pass some of the initial laws, helping states research those, learn from those, kind of grow some of these gold standards for policy that we work to implement in our state policy. And we're also working together to grow toward a national policy at this point. And I do want to note, because there are a lot of folks on the call that we need to really lean on as allies in this conversation about moving to new state policies and national work, to make sure that we're really approaching discussions about paid family leave from this place, from this equity and inclusion centered place, so that we don't settle for policies that not only don't reach the folks we need them to reach, but may do harm. So we have had some experience with that, with past policy work that really ends with programs that are functionally inaccessible to the people they're trying to reach, and or designed in a way that actually may cause harm to the people we're trying to help. This happens because communities aren't involved in actually shaping the policies that we're advocating for often, or because trade-offs are made that really often end up prioritizing more economically well-off and or white workers over inclusion of lower wage workers and workers of color. We see a lot of push. We've done a lot of work historically in Oregon around paid sick time. We led that campaign, minimum wage, domestic workers' bills of rights, equal pay, all kinds of other issues. And we see a real push to continue based on really systemically racist rationale historically to exclude a lot of low wage industries and workers from labor protections, from inclusion in these kinds of policies. And I really encourage folks to really look back at some of the history, sort of what's informed why we have small employer carve-outs, why agriculture workers, for example, have been left out of most labor standards to date. So we took those things in and really tried to start from a place of developing an equity and inclusion lens within our organization, within the leaders that we're organizing, and within our coalition. I think that's really critical to start from that place. We work to involve other organizations very intentionally who are organizing impacted people on the ground and ensure that we had a really diverse coalition. When you have people who are in direct contact, I can't emphasize enough the importance of involving organizations that organize communities in work on this and every other issue, because when you are directly in touch with and organizing folks who will be impacted by decisions, policy decisions that are made and maybe left out, it becomes, I think they're the groups that often won't make those kinds of trades because they know directly the people that would be left behind, and can make the case for why that's such a critical thing. So we worked to build a coalition and kind of anticipate some of the things based on our past work that we knew were likely to be places where we'd be asked to make trades that we felt were unacceptable to make. A little background on Oregon, we did have an unpaid leave law, the Oregon Family Leave Act, that was an expansion to the FMLA, but we were not building off of a TDI program as folks in other states were able to do. So we were building a paid program from scratch, and designed that to be a social insurance model that both employers and employees pay into, and that employees can draw a benefit down from our employment department, which also runs our unemployment insurance program. Again, I mentioned we were part of Family Values at Work. We really learned from other states, what was working, what wasn't working, sort of what it meant to have partial wage replacement for certain kinds of workers, what it meant to have no job protection in other states, and kind of designed some of our talking points and interventions around those experiences. So that was very helpful. We had a lot of conversations up front about this issue as a racial, gender, and class justice issue, and developed our policy principles from that place. I'm happy to share with folks more tools around that or information about how we did that. We talked a lot about who would be left out with different decisions, who would sit at intersections of race and gender kind of exclusions, and what that would mean for people actually being able to access the program. We named our bill the Family Equity Act. We focused our communications and messaging and lobbying on talking about these bottom line issues in that way, about who they would advance and who they would leave behind. And we really tried to shift our messaging to speak more to the importance of caregiving, the universal nature of this experience. Everyone is born, gets sick, dies, right? Every single one of us. We may not be the one caring for someone, but we might require care. We really asked policymakers to share their own experiences with this, to kind of break down the this is a program for other people, but not for me kind of dynamic that I think is really problematic often. So we focused on some real core principles around equity. We do have a 12-week leave program for medical and parental leave. It does include an additional 2 weeks of leave for pregnancy and postpartum related conditions. I don't think this is a sufficient number of weeks, especially for new parents. I definitely think that we need to be pushing for more. We decided fairly early on that we would make a trade on a smaller number of weeks that in a program that included everyone, than to have some people have a better benefit and some people have no benefit. That was an intentional decision. Our program covers all employees. There were no carve-outs by industry. All employees that were allowed to cover, the state can't cover federal folks. All of our covered employees have job protection. There is a slightly different provision around returning to work for small employers, but everyone has job protection, which we think is essential to being able to actually use the program. It does include a progressive wage replacement where folks who are earning the least in our state have 100% wage replacement. And then as you go up the income scale, that percentage is lower. We do include an expanded family definition that includes blood and affinity, so that all families, multi-generational families, families separated by their documentation status, and maybe in chosen families, LGBTQ families are included in our definition of family. It covers safe leave purposes for issues of domestic violence, sexual assault, stalking, in addition to kind of typical medical and parental and family leave issues. It has a very low eligibility threshold. So we pulled from a standard in our unemployment insurance program that allows for folks to qualify if they've earned just $1,000 in earnings in the previous year, over having to, work 840 hours in a year, or some threshold that's much harder for folks who are sort of forced into part-time work or seasonal work to meet. It allows for non-consecutive leave. So we really thought about caregivers and kind of the way that caregiving happens, and that you may not be caring for someone consistently every day for 12 weeks, but you may be sharing care with other family members and be, responsible for the care of your parent Monday, Wednesday, Friday, or, this week, but not that week. So we were trying to think about how people might actually access this. We really fought to make sure that both employers and employees were paying in, that this wasn't just an employee paid program, both benefit and both should contribute. And a variety of other things that I think are smaller but important. So we sat from the beginning and said, these are the ways that we think specific people might have trouble navigating this, and then let's set bottom lines that actually allow them to really participate and talk to lawmakers about that reasoning. So now we're in implementation, and I think that's another piece that I want to flag, which is that there's a lot of kind of interest and focus on passing these laws by partners and funders and various other folks. But the implementation of it is also really critical. We're in a multi-year implementation process, and through rulemaking, decisions will be made about how people apply for benefits, about defining terms within the legislation that could or could not, undermine some of the principles that we really brought into developing the law. So I think it's really critical to start, as more states pass this, as we look to a federal program to start to develop some of those gold standards for implementation too. Thank you.
Thank you, Andrea. That was incredibly helpful to hear from both of you. And I'm wondering now, Leanne, if you want to turn on your screen, I think we have some time to answer some questions that are coming our way. Oh my goodness, and I just lost my screen. But well, here's one, and I'm not sure, I'm curious to hear your thoughts on this, but this is a question about states without income tax. And how, if you have any advice, or if you've worked with colleagues thinking about how that works to have a paid family medical leave program in a state that does not have that as a resource. I want to talk to that. Or not, you can pass on that one and we could try to answer it later in the chat.
I think that's a great question. I'm trying to think now, does Washington not have an income tax? Is that the tax they don't have? Because we don't have a sales tax, so it's all different everywhere. I think that's true. Someone fact check me, and they have a robust program. So, our state has systems for collecting taxes, regardless of which taxes they are. They're usually on some kind of combined reporting form. And at some point it ends up with more lines. So that's what's happened with us. And I assume what's happened in Washington too.
Great. Leanne, did you want to add to that?
I don't have much, but in our state, it's not part of your income tax. There's an income tax line on your check, and then there's a line that says TDI, TCI. So I don't see any reason why you couldn't just have, it's an insurance program. It's not really, we don't call it a tax. I know I refer to it as a tax on here, but it is an insurance program. You are paying into it, and then you should be able to benefit from it. And that the pool of all the people who aren't sick and aren't having babies need to contribute to it, so that the people who are sick and are having babies can have money there when they need it.
Great, thank you.
I think I would say too, I think folks underestimate the scale of these programs. So, in our closest neighbor, Washington, we've really followed a lot of their example on implementation, and they're really, and we are too, creating sort of a new division of government within our employment department that is eventually maybe equal in size to our unemployment insurance division, because you're really talking about a program where every worker and employer is paying in. There are going to be back-end systems of integration between our employment department, our revenue department, our Bureau of Labor that enforces the job protection standards. So it's a big program where you get to design these kinds of elements. You know, you'll decide how revenue is collected, you know, into the program and how it's dispersed across agencies and gets to people. So I wouldn't let those kind of barriers prevent you from moving forward.
Great, that's very helpful. This is a question that's to you, Andrea, but I actually think there's something for both of you here. So it's two questions. So if you could talk about implementation would be really helpful. Just talk more a little bit about that. And then specifically, how do you inform employees that they have this opportunity and protections, right? So how do you get the word out? And if you have any experience in that, either of you, both of you would be great.
Yeah, so our law passed in 2019, and it begins collecting contributions to the program at the start of 2022, so a year from now, and then begins paying benefits the year after that. So you do have to have a lag in terms of, you know, collecting, you know, contributions before you can start paying benefit for obvious reasons. So our process is a little bit lengthier than other states. Other states have been able to go faster. We have a kind of system in place that requires us to meet certain benchmarks around adding new technologies and new systems based on sort of past failures around healthcare expansions. So we have to go through certain kind of benchmarks to get approval on the new technology systems that are slowing us down a little bit. But that's the overall kind of time frame. Our employment department has been leading this program. And I will say another really critical equity piece for us that we have been talking about for the last couple of years since the bill passed is the importance of having the program be publicly administered. It is not equitable to have, I mean, we've all seen the challenges and failures of private health insurance, especially for low-income folks. It is not equitable to have a system that is administered with kind of profit-making motivations. Increased claim denials and things like that. So we have felt very strongly that the program needs to be held within state. That doesn't mean they won't subcontract with different companies to do discrete parts of the program, but that the core functions of the program are public and accountable to the public. So we have been working in a variety of different work groups that include employers and employees, kind of advising the employment department as they draft their rules. It's not naturally a system that's easy for workers to participate in. And so it's really been a flag for us that they need to add some additional kind of points of engagement to make sure that they're really getting feedback from some of the employees who would have the hardest time accessing the program. And so we hope that they'll do that. We've been in discussion with our state agency about how to improve the equity lens that they're bringing to the implementation work that they're doing. Which I think more of our state governments need support in doing, and some tools to help implement. And then as far as outreach, you know, I think we're going to be looking to some of the models used in Washington, where I think they actually did a very good job of getting the word out before the program. They had far more claims on day one of their program than they expected, I think, because of some of the successes of their outreach. So we'll learn from that challenge and be prepared. But they had a really robust community engagement plan and outreach and you know, communications going out on all different kinds of channels to make sure, and through community organizations, which I think is essential because they're the best messengers to their communities about accessing services. So they had a really robust plan that I hope we can like learn from and improve on and make sure that people really know they have this, or else it's not going to do them any good.
Oh, that's really helpful. And we need to wrap up this section, but Leanne, I just want to give you maybe 30 seconds if you have other things to add.
The only thing I would add, the couple really key issues in our state were foster parents and adoptive parents, and attempts to try to prevent them or not include them in this when it passed. So we had to fight hard at the legislative level, and then at the regulatory level, when the first regulations came out, there were additional things that foster and adoptive parents had to do in order to get it. So that's really important to watch out for. And then you know, it's easier to find the moms because they're pregnant. And in our state, they get disability, and then they can get caregivers insurance, and there can be a time lag around birth certificates. That was a challenge in our states, and dads had to wait for the birth certificate to prove that they were the dad or the other parent. And so we have made that a lot of changes to improve on that, but so it takes time, and it takes time for the word to get out, particularly for people who don't give birth, that they are also eligible for this as a parent.
Thank you. Very important flag. Thank you both for your contributions to this conversation, and even more for your work and your tireless advocacy. I know that that is not easy, and so we're so grateful, and thank you for sharing your lessons here with us today. I'm going to hand it over to Cynthia, who is going to introduce another one of our guests from NCSL. Thanks, Cynthia.
Well, great. Thank you, Myra and Andrea and Leanne. What your states are doing is just so important, and I appreciate you sharing that. And there are so many questions coming from other states. And the person who knows a lot about what's going on within this area and other policies across states is Alison May, a policy associate at the National Conference for State Legislatures. Most of you are probably familiar with this organization, and if you're not, I encourage you to look them up and access their resources. We look to them as an expert, and hopefully we can partner with them in lots of ways. But Alison is going to share what she sees at the national view with regard to this policy in this last sessions and this coming legislative session or current one. Alison, take it away.
All right. Good afternoon, everyone. And thank you, Cynthia. Thank you, Myra, for inviting me to share a little information with everyone. And hopefully you see my screen now. So over the next few minutes, what I want to do is just share a little bit about who NCSL is, what the work is that we do, and then kind of give you a little tour of some of the legislative work I've seen happening in 2019, 20, and 21. So NCSL, the National Conference of State Legislatures, is the country's most trusted organization, serving legislators and legislative staff for over 40 years now. And we promote policy innovation and create opportunities for lawmakers to share and learn from one another. And another big thing is providing a cohesive voice in Washington, D.C. So we do this primarily because the legislative institution is important, and we know when states are strong that our whole nation is strong. So on this screen in front of you, you can see a handful of different activities that we do. And I'll just highlight that we track over 1,400 issue areas, and on a normal year, have about 100 or more policy-oriented meetings. So I am personally in our early care and education project that is housed within our children and families or human services program area. And specifically, the policy area for ECE, we say it's prenatal through pre-kindergarten. So that's what we're really laser focused on. And this shows just a couple of the different activities that we do, but our legislative tracking is very important, and it includes things like childcare, home visiting, pre-kindergarten, parental leave, and so forth. I would mention that our writing is really produced with our members, legislators and staff in mind, but also the resources are available to anyone. And I'd encourage advocates to take a look. It could be helpful to share with state policymakers as you're talking to them. And then in terms of our meetings, I'll just share that both Cynthia and Myra have graciously presented to NCSL members before about their resources. And I just think that the roadmap and the yearbook both are just very important resources for policymakers. Oh, before I go on, actually, I do want to mention, I'll keep it on this slide, but no surprise, but paid family leave really is a policy topic that crosses over. So I work on it in the ECE area, but NCSL also has staff in our employment, labor, and retirement program, and they too look at this topic. So let's start to think about the legislative action that we've seen. This image comes from a 2020 report and just shows you sort of the timeline of legislatively related paid leave since 2002. So let's hop in our little time machine, go back to 2019. And in 2019, we can see here, and this has been mentioned, but the states in yellow are the states, the 6 states in DC that already had paid leave programs in place. And noteworthy is that 4 of the states actually were paying out on the benefits. So California, New York, Rhode Island, and New Jersey. And then the blue colored states are those that introduce legislation for consideration. And I would just say that on the next slide, you'll see many of these same states in that blue shade, which essentially just means this is a topic that's coming up on an annual basis in state houses. In 2019, we also found that Connecticut and Oregon enacted paid leave. Benefits will start in 2022 and 23 respectively. And also in 2019, Colorado, my home state, enacted legislation to create a task force. And so the task force analyzed 16 elements related to paid leave and also produced a report with 21 recommendations, all of which is available online. So then when we shift our attention to 2020, and of course, it was a unique year. While we did see bills introduced in a broad array of policy topics, I will say that there was a fair decline in the number of introduced and enacted legislation, in particular as policymakers were really shifting their focus to the pandemic response. Even with that, we did have about 25 states introduce paid leave legislation, and at least one, Colorado actually again, enacted something into law. So Senate Bill 205 created the Healthy Families Workplace Act. It had some information related specific to the response based to the pandemic, excuse me. And in addition, it had information pertaining to Colorado employees now paying sick leave for employees. So at a rate of 1 hour for every 30 hours worked, those in the state of Colorado can earn sick leave now, paid sick leave. In 2020, we also found that Washington, DC and Washington State started to pay out the benefits on their programs. And then perhaps the most exciting news of 2020 was in Colorado again, due to the November election. So in November, Colorado posed the question to voters about paid leave through Proposition 118. And in the end, 1.8 million Coloradans, or about 58% of those that cast ballots, said yes, they supported establishing a paid family and medical leave program. So that program is going to provide 12 weeks of paid leave, in some instances up to 16. It'll be funded through a payroll tax and paid 50-50, employees, employers. So what's particularly unique about this is it's a first. This is the first time that we see a paid leave program start through a ballot measure and not legislatively. And, you know, to Andrea's point about implementation, I think this is where the fun really begins, right, in Colorado. What happens next? I can say anecdotally, I've been told there'll be some implementation related legislation this session. Some of you might know that Colorado is actually not in session just yet. They're on a recess till early February, so we'll just have to wait and see what happens. So this image in front of you comes from NCSL's website, and I'm just sharing it so you can see which states are in session and which haven't begun yet, or maybe are, haven't begun or are on a pause due to the pandemic. The main takeaway, the better part of states are in session right now, which means introducing legislation and inevitably enacting. So personally, I've been tracking legislation in a handful of states related to paid leave. All of that information is available on our early care and education legislative database. Specifically on the top, we coded into the topic prenatal infants and toddlers. So I've seen about 15 or so states at this point that have introduced related legislation. And so over the next few slides, I'm going to share with you just a little example of what we're seeing across the country. And I do want to underscore that I'm unable to predict what's going to happen. So we all get to just sort of wait and see where these pieces of legislation go next. So first I wanted to share in Indiana, they have bills in both chambers to create a paid family and medical leave program. And if enacted, it would, the Department of Workforce Development will establish the program. It would be funded through appropriations from both the General Assembly and payroll contributions. And noteworthy, the House bill in Indiana has a sponsor and co-sponsor from both sides of the aisle. And then in Kentucky, worth mentioning, they also have bipartisan legislation right now. So they have a House bill sponsored by a Republican, the identical Senate bill sponsored by a Democrat, and you can find both of those pieces in our legislative database. So next up is Nebraska, which has two separate but sort of related pieces of legislation that I wanted to highlight. Nebraska has been introducing related legislation over the last handful of sessions, although this time around it's a different primary sponsor, actually the same individual for both of these pieces of legislation. So the first bill is a very comprehensive paid family medical leave program, has up to 11 co-sponsors at this point. It would offer 12 weeks of paid leave, the payments on a sliding scale and determined based on what an employee earns related to the state average weekly wage. And the fund would be administered through a commissioner of labor and would consist of private donations, money transferred or allocated by the legislature, along with contributions from covered employers. And then the second piece is sort of interesting. It's suggesting changes to tobacco product taxes. There are a whole host of different things that they're suggesting money go toward, but one of them notably is $30 million to be appropriated over the next couple of years to pay some of the upfront administrative costs of standing up a paid family and medical leave program. And I would just say there are a few other prenatal-to-3 sort of related, I guess, earmarks within that bill. Maternal health care projects is one of them. So if we go on over to the land of enchantment, New Mexico, and I'm pretty sure I saw some folks from New Mexico on the line, I want to call out the legislation that they have for the program. It would be administered through the Workforce Solutions Department. And one thing that was particularly unique to me about this bill was it also would create an implementation advisory committee. And that committee would consist of 13 individuals, folks ranging from members of chambers of commerce to small business owners, individuals that represent parents of newborn children, and representatives of adoptive and foster parents. And the real goal of that committee, they'd meet for about a year, and they would be tasked with coming up with best practices, efficient and timely development, and sort of how to implement the program. And so this House Bill 38, very similar to legislation that's been introduced in past years in New Mexico, excuse me, it would allow for up to 12 weeks of paid family and medical leave. And here the benefit structure would allow for low-income individuals to receive a higher percentage of their income than higher earners. And then my last two examples are really just to show that there is a lot of variety in what states are doing. So these are two pretty narrow focused bills in Arizona and South Carolina, where we find it's paid parental leave for state employees only. Primary difference is 6 weeks in Arizona and 12 weeks in South Carolina. And I should mention, Arizona has at least one or two other bills related to paid leave that they've introduced already. So just a little taste of what's going on so far in 2021. And check out the database that's linked, and you can see, sort of follow the path of these bills and see what gets enacted. So here are a whole host of related information that might be helpful to the work you do, and my contact information. And now I will stop sharing my screen so I can see Cynthia.
Well, thank you, Alison. And it's just really helpful to see the range of bills that are being introduced, and they're in red states, blue states, purple states. This really is an issue that cuts across the aisle. And I know that we have to wrap up, so we don't have a lot of time for questions, but I just wanted to pose one to you, or kind of a comment, have you reflect. As bills get introduced and we see that 10 states have enacted legislation, every state is so different in the way that they're funding it, in the way that the benefits that they're offering and so forth. Do you think that we will move towards some common principles? Are there any common threads out there that you see that are kind of best practices that states could start to adopt? I know Myra and 0 to 3 is pushing heavily for national legislation so that we would stop all the variation. But is there anything that you see that states are really latching on to?
I think it's a good question. And, you know, one of the things that I say when I look at this policy really is, it's not a yes, no, you know, question answer for a policymaker. It's a lot of nuance within and what really fits with your state. I think that more of the recent legislation, you know, Oregon as an example, seemed to be a lot more inclusive than some of the earlier measures, but I don't have a crystal ball and I'm not sure, but there are a lot of options. And I would say in the report that I had this fall, right at the end, are all the different pieces you can consider. Who are family? How long? What's the, you know, replacement wage? Who's paying for it? So you know, it's a great question.
Yeah, but the variation is so wide, and these are questions that each state is going to have to address. And hopefully, as more and more states do this, and what we're following is the research that provides us with some guidance on what is the optimal benefits for families to improve the outcomes that we're hoping for. But the variation is quite large. Well, thank you so much for your time with us today. I really appreciate it, and encourage folks to go to that legislative link that you provided, and we'll provide that in the chat as well. And I'm going to bring Myra back in to close us out for the day. And I thank you all for joining us. And Myra, thank you for co-hosting this with us.
Oh, it's such a pleasure to do this. Thank you so much. And thank you to everyone from Leanne to Andrea to Alison, our partners across the country, and everyone who's tuned in today. I just want to wrap up by, and I really want to thank our respective teams who have done a lot behind the scenes. So thank you guys. I want to just wrap up with resources here that you see on the screen. So obviously the roadmap, which is a great resource, and hope you all will really dig into the research behind, you know, why we advocate for what we advocate for on our side of the fence, if you will, and then some more resources on the evidence on paid leave. And then of course, please go to 0 to 3's website where you get these resources. We can help you, you know, make the child development case for a national paid family and medical leave program. So great resources there. There's also the paid leave advocacy toolkit, and of course, State of Babies Yearbook. And the 2021 State of Babies Yearbook will be released in late April. So please stay tuned for that. You can also go to Family Forward, Rhode Island Kids Count, and then NCSL has some great resources. And then many of you, both state partners, mentioned Family Values at Work. So definitely want to put in a plug for Family Values at Work, with whom we partner on Think Babies, and many of you partner with across the country, and they're great supports here too. So thank you all. I don't think we have time for a final question, but I just want to say thank you. And you know, please go out there and learn as much as you can. And those of you who are advocates, please, thank you for all that you're doing, and please continue to keep up the pressure. We really need this. Babies need this, families need this. And really, it's good for employers and it's good for this country. So I will, with that, I will say thank you and keep up the good work. Thank you.